Okay. I'm very happy to again host for us the Journal Club for the International Motor Development Research Consortium. This is exciting. I always get a chance to hear great talks from people about the research they've been doing, the articles they've been writing. And today we're very lucky to have one of our friends and authorities on developmental coordination disorder. And she's going to, I hope you went to the website and you have her article in advance, because when we used to run the Journal Club in my lab, you had to read the article ahead of time. And then you talked about the article rather than listen to the author tell you about the article. But I'm going to turn this over to Jill, and again, ask everyone to mute themselves. She will give a talk about the article, and I'll let her introduce her own article and her co-authors. But if you have any questions, then I'd like you to put them in the chat box, and then at the end, I'll read out your questions to make sense of them as we go along. So turn this over to Jill and ask her to share her screen.
Great. Thank you very much, everyone. And thank you for including me in the Journal Club today. So my name is Jill Zwicker, and I'm a professor in the Department of Occupational Science and Occupational Therapy at the University of British Columbia in Vancouver. I hold a Canada Research Chair in Pediatric Brain Development and Rehabilitation, which forms part of this work that I'm going to share with you today. And then I have other affiliations, especially with BC Children's Hospital Research Institute. So thank you again for inviting me. And what I'd like to talk about is a paper that is co-authored by two of my trainees, where we looked at motor impairments in children with autism spectrum disorder. And we did a systematic review and a meta-analysis. Before we begin, I'd like to first of all acknowledge that I am currently on the traditional territories of the Lekwungen-speaking peoples, represented by the Songhees and Esquimalt nations, and the Wasnak peoples, represented by the Tsarsalip, Pakachin, Suaut, Tuscum, I think, and Malahat nations. So this is colonially known as Victoria. But the work was conducted in Vancouver, which is on the traditional and ancestral unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I'd just like to take a moment to express my gratitude for these First Nation peoples for their stewardship of the land and the seas on which we live. And in the spirit of truth and reconciliation, continue to be grateful for their involvement. So the paper that I hope you have read, because I didn't go through the paper in great detail, but is published in the Journal of Autism and Developmental Disorders. And my co-authors are Malika Kangarani Farahani, who is a PhD candidate about to defend her thesis next month. So she's getting excited to be finished. And Myra Malik was a master's student at the time and has since gone on to become an occupational therapist. So she also has a keen interest in motor impairments in this group of children. And then myself. So I just thought I'd start off with the DSM-5 criteria for autism spectrum disorder, because it's important to know that we're all on the same page. And then I'll do the same for developmental coordination disorder. So as we know, autism is classified as persistent deficits in social communication and social interaction across multiple contexts. And these three criteria must also need to be met, that there's deficits in social and emotional reciprocity, nonverbal communicative behaviors for social interaction, and deficits in developing, maintaining, and understanding relationships. So that's the first important criterion. The second is related to restricted, repetitive patterns of behavior, interests, or activities. And here we have, they must present with at least two of the following. So stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness, inflexible adherence to routines and ritualized behavior, highly restricted and fixated interests, and either hypo or hyperactivity to sensory input or unusual interest in the environment with sensory input. So with this definition of autism spectrum disorder, there is no mention of motor impairments, with the exception of the repetitive and stereotypical movements. But we know from previous systematic reviews that children with autism have motor deficit. Up to 50 to 88% or 85% of children with autism will have motor deficits. So this was in a previous systematic review that was done in 2010 this one's 27. There's been another in 2010. But since the DSM-5, a dual diagnosis of autism spectrum disorder and developmental coordination disorder has been permitted. So previously in the DSM-4, it was an exclusionary diagnosis, but now with the recognition of motor impairments in children with autism, this dual diagnosis is now possible. So the diagnostic criteria for DCD, or developmental coordination disorder, are that the motor skills are substantially below what you would expect for the individual's age and their opportunity for skill learning and use. So they've had sufficient practice and exposure, but continue to perform below age expectations. The second aspect is that the motor skill deficit must significantly and persistently interfere with activities of daily living. And that includes school productivity, pre-vocational and vocational activities, leisure, play, and basically affecting day-to-day life. The onset of symptoms is in the early developmental period, so it's not something that comes on all of a sudden. There is a developmental trajectory from a young age. And then finally, that the motor skills deficit is not better explained by some other medical condition, such as a neurological condition like cerebral palsy, a visual impairment, or moderate to severe intellectual disability. So that's the definition of DCD. So what we set out to do with this systematic review was to determine the prevalence or update the latest systematic review on the prevalence of motor problems in autistic children since the last review, understand the nature of motor difficulties and whether they are consistent with DCD, and then finally to determine if the term DCD was used as a co-occurring diagnosis since this was permitted in 2013. So that's what we set out to do. And we did a systematic review of the 4 major databases. So Medline, Embase, CINAHL, and PsycInfo. And we had 2 reviewers independently select titles, abstracts, and full text articles. So we did a staged approach for selecting articles. And the citations were all imported into Covenants, and we used Covenants as a management tool to facilitate this systematic review. So our inclusion criteria were basically school-age children, so aged 5 to 12 years, who had a diagnosis of autism spectrum disorder. And it's important to note here that we only included those without an intellectual disability. So they needed to have an IQ above 70. Because we felt that children with autism with an intellectual disability may or may not have motor deficits that are associated with global developmental delay as opposed to DCD. The other inclusion criteria was that the study needed to look at a standardized measurement of motor skills, which would be the equivalent of criterion A for DCD, or a functional measure, looking at the functional impact of the motor skill deficit. So meeting criterion B of the diagnostic criteria for DCD. And we selected any article published in English that was published between 2010, so since the last systematic review, up until the time when we did our search, December 2021. So we excluded papers that were systematic reviews, commentaries, conference proceedings, and animal studies. But if we did find a systematic review, we did scour the reference list of cited studies to look for original papers. And we wanted studies that focused on the motor issues, or sorry, excluded studies that focused on the motor issues associated with autism, such as those stereotypical or repetitive movements or difficulty using gestures, if that was the primary focus. And we excluded papers where the motor difficulties could be explained by another condition, such as cerebral palsy or genetic conditions that may affect motor skill acquisition. So once duplicates were removed, we retrieved just over 4,000 articles. And after going through title, abstract, and full text screening, we ended up with 27 articles that met our inclusion criteria. The vast majority of these studies were cross-sectional in nature. 14 studies compared children with autism spectrum disorder to typically developing children. 7 studies compared their motor skills to standardized norms. And there were 6 intervention studies that compared intervention between groups of children with autism, but we only extracted the baseline data to look at differences before intervention. We assessed the quality of all the studies using the appraisal tool for cross-sectional studies. And of the 27 studies, 22 were rated as high quality. So we have good quality evidence that we're examining. And the outcome measures we were most interested in were those related to motor assessments and functional measures. In terms of motor assessments, the most common assessments that we cited in the literature were the movement assessment battery for children. So either the original version or the second edition. The Brunick-Sozaretsky, again, the original version or the BOT2. And the test of gross motor development, either the second or third edition. There were other motor measurements looking at strength and other motor skills, but these were the main measures. The functional measures, we had less variability here. There were only 3 functional measures that were in the literature. Most commonly was the Vineland Adaptive Behavior Scale, either the second or third edition. And this makes sense in terms of looking at adaptive skills of children with autism. So only 2 studies used the DCDQ, and one test looked at the, or one study looked at the handwriting performance test, the speed component. So these studies either had a functional motor measure, such as this, a standardized motor assessment, or both. So of all the articles, so 25 out of 27 articles, so 92%, reported that children with autism had significant motor impairments, either on the motor assessment or the functional questionnaires. So the vast majority showed these significant impairments. And the prevalence of motor problems across all studies ranged from 50 to 88%. So that's a large number. And we know that motor deficits are under-recognized in children with autism, and rarely are motor deficits the focus of therapy. Therapy tends to focus on the communication, behavior, and sensory needs of the population. So these motor deficits go under-acknowledged. We further looked then at where we could do a meta-analysis. And so you need at least 3 studies in order to conduct a meta-analysis. So here we looked at all the studies that used the movement ABC2 as their outcome measure. And you can see here that the children with autism had a standard score between 5 and 6, which we know is well below the average range, whereas the typically developing were like right smack in the middle between 9 and 10 standard score. And overall, we see a great effect here for the children with autism. They have at least 4.5 standard score difference compared to typically developing children. And here we have motor scores on the Brunek-Sozaretsky, the BOT2. And one of the studies used both the movement ABC and the BOT2. So it is listed twice in each, or listed in each meta-analysis. Again, these are, I believe these are percentile scores and, or sorry, they're standard scores. So children with autism here are, you know, somewhere between 36 and 42, and scores of 40 and below are considered a significant motor deficit, whereas the typically developing here are between 51 and 66. And again, there's almost 19 point difference between autistic children and typically developing or neurotypical children. So there's no doubt that children with autism have a significant number have motor difficulties. However, only 3 out of 19 papers that were published from 2014 identified these difficulties as DCD. And further, one study looked at of all the children with motor difficulties, only 15% had been given a co-occurring diagnosis of DCD. So this is a bit problematic, and I'll talk about more in just a moment. So the development of motor skills is necessary, as you know, for performing self-care tasks from, you know, getting dressed, tying shoes, brushing teeth, preparing a simple meal, all leisure and play activities, which is the main occupation of childhood. It's an important component of social communication, which is, of course, a primary deficit in children with autism, and of course, for learning. And so motor skills are necessary for all of these skills. And we know that children with autism show difficulty with both fine and gross motor skills. And this further impacts social skill development. So for instance, taking turns throwing and catching a ball, for instance, or playing any sort of physical or gross motor game is where we also learn a lot of our social skills. It's important for adaptive behavior, so day-to-day functioning, and then of course, quality of life. And so these motor deficits, despite being very common in this group, are again under-recognized and underdiagnosed. So in terms of clinical implications of these findings, we feel that it's important to routinely assess children with autism for DCD. And the international guidelines suggest best practice is using the Movement Assessment Battery for Children 2, soon to be 3. The version just has been released, and the Developmental Coordination Disorder Questionnaire. And this questionnaire is freely available online and readily available. So, and I think we should also advocate for a DCD diagnosis when it's warranted. And why that's important, I think, is because we have evidence-based treatments for DCD. And if we call it DCD, the children are more likely to get that evidence-based intervention. Now, I know it's not standard of care in Canada or the US and in most countries around the world, but until we start advocating for more, you know, it's never going to become standard of care. And I think children with autism, because they receive funding and support in a lot of countries, that they could receive evidence-based treatment such as co-op to improve their functional motor skills and the motor tasks that they want or need to learn. So just in conclusion, again, DCD is underdiagnosed in children with autism. And I think this is really important to recognize, again, because we have this evidence-based therapy. And we also know if we address the motor deficits in children with autism, there's a positive effect on the core deficits associated with DCD or ASD, my apologies. So I think if we accurately identify these motor deficits, call them developmental coordination disorder, and address them appropriately with intervention that we have the evidence to support. I just like to take a moment to acknowledge Malika. The first author was funded by the UBC Faculty of Medicine and the Azrieli Foundation. Myra, the second author, was again supported by the Faculty of Medicine and a Sid Vernon Graduate Student Award. And I myself am funded by the Canada Research Chair Program, the Canadian Institutes of Health Research, and BC Children's Hospital Research Institute. And just before I take questions, I just want to provide a plug for a newly formed International Society of Research and Advocacy for Developmental Coordination Disorder. So this is a nonprofit society of researchers, clinicians, people with lived experience of DCD, whether they're adults or parents of children with DCD, as well as organizations with an interest of DCD. And what we're hoping to do is build a global network of these different parties to, again, build the research evidence base, but also advocating for supports and services. So if you have an interest in DCD, I strongly encourage you to take a look at the website and consider being a member. And in addition to providing for the greater good, there are some member benefits, one of which is a discount to the next DCD meeting, the international DCD meeting in Belgium, and also in conjunction with the IMDRC 6th meeting. So it's a joint meeting in Ghent, June 5 to 8. And I think they've got a great program they're pulling together, and a wonderful opportunity for these two organizations to come together. Again, power in numbers. So with that, I'll pause here for questions.
So I'd ask everybody who has questions to put them in the chat, please. And I want to thank Jill for this shameless plug here at the end for the conference. And also for you, flip back once more to your website. There you go. For this, I'm so pleased to see that DCD now has a formal structure, since it was always just the structure that moved from one conference to the next every year. So I don't see chat questions yet. Come on, Michigan. Always, I'm calling you out. But I am going to ask you just to talk a little bit about the, I guess I'd call it the nitty gritty of doing one of these. And that's your Axis a tool for assessing these. This is new to me. I'm not sure I'm aware of how that works. It's an appraisal tool for judging cross-sectional studies.
Yes, so there's many different options to evaluate quality of studies that go into a systematic review, and this one just seemed to be most amenable because the majority of studies were cross-sectional, or we were taking cross-sectional data from the longitudinal studies. So it was one that was the easiest to use, and because they were all that same study design. It may not be as applicable, when you have varied study designs looking across studies, but in this case, these weren't really randomized controlled trials or needing to look at quality in that regard, but for cross-sectional studies, it was great.
So do you put them into a software package? Is that the idea, or how?
No, there's, I can't remember now if it's 10 or 12 questions. And so you are evaluating each one. So it is still judgment, but we had 2 people do it independently, come up with a consensus score. But where there was the software that we use was called Covenants. And that has been a game changer for conducting systematic reviews, as it keeps track of, it removes duplicates for you. It keeps track of all the decisions along the way. It can produce your sort of Prisma table at the end, and keep track of any conflicts and how they were resolved by a third reviewer. So it's all automated now, as before is
Nice.
keeping track on your Excel sheet or your pencil paper version.
Is that on the internet? Do you find a website for
Yes.
that or something? Okay.
Yes.
That is new. That's something interesting. My assumption is that Access will eventually become like an AI tool as well. So you can just run your PDF through it or something and it will take care of it. I'm going to be on another AI webinar that does kinds of things, and if you all haven't used ChatGPT, it's just amazing. But there's ones for analyzing data also that are AI oriented. So I was thinking, that was why I was asking whether Access was like that, but you're saying Convergence does that.
Covenants, yes.
Yeah, Covenants. I'm sorry, not Convergence. Sorry. I'm
Yeah.
looking right at it on my screen, so I just said it wrong. Yeah.
No problem.
Okay, so we finally have someone who's going to ask a chat question. Okay, Lisa Barnett. So if the study were focused on some aspects of improving motor competence and they included children with autism, they may not have asked whether the person had a diagnosis of DCD. So they may have, but it may have been reported in the article, but not necessarily the case. So can you tell whether they actually asked them whether they had that diagnosis?
So not all studies reported that, but they certainly didn't describe them as children with DCD or co-occurring DCD in the study. There was one study by Dr. Batt looking at the SPARK study, and there it was determined that only 15% of those with motor difficulties actually had the diagnosis. So I suppose we could be underreporting, but if it wasn't in the article, then we didn't have any option to know that they might have asked about DCD unless they said so.
So if you could stop sharing screen for a moment, I could see there is another one where people can raise their hand as well, and then we could see everyone. The next question.
Jill, can I ask a follow-up question to you and maybe Lisa at the same time, which is, I know in our samples, I mean, we've only had like 1 or 2 of our autistic participants with a co-occurring diagnosis of DCD at coming into the study. So I'm curious, Lisa, since you've, had some of that experience as well, like what proportion of your autism sample typically does carry that co-occurring diagnostic label? Or for Jill, the same question for you, I guess.
Do you want to go ahead, Lisa?
Oh, sorry, you're asking me. I'm half asleep.
Remember, she's in Australia, folks. Just to be clear, look that up. What time is it there, Lisa?
It's not actually that early. I'm just a bit tired. It's only 7:30. I think I'm just going off on a tangent, but I think it's also related to the country, because this diagnosis of DCD, it sort of depends on where you are as well. And I don't think it's something that's as common in Australia, even though it's not my direct research area. So the studies I've been involved in have been led by others, and we haven't actually asked whether they had that diagnosis of DCD. So it's not reported, and it's not something that really featured. But yeah, so I mean, I guess the likelihood is that they didn't, but I thought, well, we don't actually know that unless they've asked that. And I wonder, when you looked at your analysis, were there differences across country as well? So, I mean, I've gone into a slightly other direction, haven't directly answered your question, Hayley.
Well, but it makes the point that I used to say when we were doing work on children with DCD, that it was a problem only in the Commonwealth countries. So I'm surprised, Lisa, that you didn't say that, but it seemed like it was Canada, Great Britain, and Australia and New Zealand who use that term, and it was very late in coming to the United States as a term, as Hayley probably knows as well. So Jill, other comment on whether you think it's different by countries?
Well, I think it's under-recognized even in Commonwealth countries. So even though the countries that may seem to, have DCD on the radar, it's still you know, I long for the day where I can say that it's no longer under-recognized and underdiagnosed, but I think the first thing we need to do is create awareness. And, you know, if physicians are using either the DSM-5 or the International Classification of Diseases, it's in both of those disorders. So it should be present everywhere. It's just that people aren't aware that it is a diagnosis and what the consequences are of having a diagnosis, and what a difference it makes to families to be aware and to have the diagnosis. So I think it's until we start to increase that awareness, we need to keep pushing the envelope forward.
So although your talk was on children, do you have a comment relative to the diagnosis later on in life? Because many people sometimes don't get these diagnoses early in their life. Do you ever see that either as a therapist or in your readings?
Yes, absolutely. So even though I work at a children's hospital, I have many adults contact me saying, how can I, you know, I think I have this, how can I get assessed? And at the moment, I'm having a hard enough time educating pediatricians. So I haven't gone to, you know, adult neurologists or, but where it shows up sometimes is in psychiatry, actually, because of the people having anxiety or depression secondary to their motor difficulties and having a lifetime of, you know, failures, so to speak. That's where it tends to come up. So I think we can target a few physicians in adulthood as well. But our colleagues in the UK have done most of the work related to adults, not necessarily about the diagnostic pathway, but the impact of DCD in adulthood.
Okay.
Yeah, so
Kip,
it's here.
okay, Kip, do you want to unmute yourself and ask your question?
Sure. Thank you so much for that insightful talk. I really appreciate you sharing your research. I'm glad I got to say that because I didn't type it first.
Thanks, Kip.
I guess I was just thinking about when you mentioned parents being advocates for the DCD screening. I guess in your maybe more anecdotal experience in this population, do you find that parents tend to be maybe less concerned with the motor delays, or is it this lack of knowledge of and you think you kind of already touched on this already, but lack of knowledge of DCD and the potential for diagnosis and intervention services as well?
Yeah, so I think initially, you know, obviously autism is the main, the core symptoms of autism are usually of what's most concern for families. But I think once those are kind of addressed, and then especially when a child gets to school and then it becomes more apparent that, you know, they have issues with printing and they're not accessing the playground, they're not doing well in PE class, that is where it starts to have a greater impact. And I think, again, without motor being part of the autism diagnosis, then it's important to look at motor. Now, coincidentally, children with autism also have other co-occurring neurodevelopmental disorders, so DCD, ADHD, and so on. So I think, you know, some parents have joked about their, you know, alphabet soup after the child's name, but unless we call it something, it doesn't get addressed, either support at school or intervention. And so I think we need to call it what it is, and then advocate for services.
I think just if you could go back and comment about this as parents, and about the interaction between a diagnosis of autism spectrum disorder and DCD. In other words, if you address the motor side of it, do you think you might get some benefits to the rest of the other undiagnosed ADHD, for example, if that's also in the alphabet of problems?
Yeah, well, there is some suggestion that if we work on the motor skill deficit in children with autism, it does have a positive effect on the core symptoms. So they do see improvements in social engagement and social joint attention, social interaction, because now they have a means to be able to play with children. So kids with DCD tend to withdraw from physical activity and those social opportunities. And so children with autism already have that challenge, but if you give them a tool through their motor abilities to be able to engage, then, you know, they're more likely to then you can work on those social skills in the context of a physical game or sport or something.
Mhm.
Jill, I wonder
Um,
what you think too about maybe the level of just like cognitive load and automaticity, because one of the things that we talk about with our participants a lot in the lab is like, if you're having to focus all of your energy on executing motor control, just like sitting upright, not falling out of the chair, standing upright, walking in a straight line, then it drags you out of some of those other things that you would otherwise focus your attention on. And so maybe it's not even so much that the motor is improving the social directly, but that reducing the load of the motor is freeing up resource for other skills that could be directed to. So I wonder if you have thoughts about that.
Yeah, that makes good sense. I mean, we don't have the measure of the why, but just the observation that it does. But I think that's a good hypothesis that, you know, it is freeing up those cognitive resources to then be able to devote. But I also think environmentally, it's giving kids the opportunity as well. So yeah, so I think it has a lot of benefits. You know, we can sort out the why later, but yeah.
mhm. So another question from Elham, which I think I can relate to completely, at least with the children of DCD that we've had who also had ADHD. Sometimes the other disorder gets in the way of actually assessing the motor proficiency. So how do you see this interaction? I mean, you probably assess children who have autism as well as DCD. How challenging is it to give them directions and give them the idea of something, or to do the fine motor kinds of tasks?
Yeah, it certainly can be challenging. And then one, to get them to do it, and then second, to determine, you know, why are they having difficulty? Is it because they're not attending, they're too impulsive, they're not understanding the instructions, and so on. But I think it's the important part is the motor assessment is one piece. So one, you get a score, but two, you have your clinical observations of how they're actually doing the task. And then what I think is the most important element is the interview with the parent about the child's motor history. And is it just a coordination issue, or do they have a longstanding issue with learning motor skills? And it's that motor learning that is a key piece for DCD. And so with that history, and then observing the child, like during the movement ABC, for instance, you can give cues during the practice round. And how does the child respond to those cues? Does that make any difference to their behavior or not? And usually for kids with DCD, you can cue all you want, but it doesn't necessarily change their behavior in that short period of time. Whereas a child, say, who has ADHD, who is not really paying attention and just, you know, throwing the ball, if you give them the cue and they can execute it after that, then it's probably not DCD, it's probably the ADHD. But
yeah, I think you hit on something that I don't think has been underlined enough in the literature about children with DCD having difficulty learning something, you know, and I don't think that that's, you know, whenever we do these tests, they don't really have a component of learning in them. They're performance measures. And so it's like what they do right there. And again, the trick of the good therapist is to get the best performance out of them, like anyone. I mean, you can just give a test, but getting the right representation of the child, as you said, a therapist will also observe the child and do all those things that are not necessarily a score of how far you threw the ball or whether you hit the target or something like that.
yeah, correct. Yeah.
Yeah.
It's often the how they do it that's telling.
Yeah. So the question, LM followed up and said, my question is solely related to the appropriateness of tools that are being used to assess motor difficulties in autism. So the question is, do you think these tools are really the best ones for kids who have autism?
So I would say
maybe you could create a new one.
I would say for the children that we used to call high functioning autism or Asperger's. I mean, we're discouraged from using those terms now, but I guess children with autism without moderate to severe intellectual disability. I think they are appropriate for that group. I think it's different for children with autism that have an intellectual disability, or they're that more global developmental delay, or more severely impacted in terms of, you know, being nonverbal. I think that group of kids with autism, I think that's a different story. So this systematic review was focused on those kids without those co-occurring, or sorry, not co-occurring, but without the intellectual disability. So it's the higher functioning, if you like. And similarly, the treatment approach that we would use for those kids also requires that higher functioning. So it's really that group that I'm talking about.
Okay. And that very large group in the back there, the University of Michigan, of course, the other University of Maryland being another we have no one from Minnesota, so we can say that. Given the sample, primarily male, lower support needs, et cetera, do you think these findings would be similar in an autistic population with higher support needs who might have been excluded from this review, IQ less than 70 or higher than or greater than 70?
Yeah, so I think, so the results I don't think are generalizable to that group, but what I would say is that I think the motor deficits are likely to be even higher in that group, but not perhaps due to DCD, but more the intellectual disability, so that more global developmental delay. And if that's the case, our treatment approach is different for that group of kids. And maybe motor isn't their most important concern. Whereas in kids with high functioning autism, pardon for using the old language, but that's the best way to describe them, is that, you know, maybe they have high IQ, they're bright kids, they, you know, are managing reasonably well, but it's the motor piece that's interfering with performance at school and meeting their potential and written output, or participating in physical activity and so on. So for the kids that are more, have higher support needs, then I think they're, we would treat them more as a global developmental delay and not, and use evidence-based interventions based on that as opposed to DCD.
Okay. I want to say to everyone, I'm not sure we all picked up on this, but there's a new MABC3 out. And how is, I haven't heard about this. So how is it going to differ? You know?
So I know a little bit. So one thing,
and besides, you've heard it here first, folks.
Yeah, so it is available. It was back ordered or not quite available yet. So I've literally just received mine and taken it out of the box. That's as far as I've gotten. But I was part of the review panel. And so what I can tell you is that the age band has been expanded to go up to age 25. So the age bands have changed slightly. I can't remember where the cutoff is, but it's, so we have still 3 age bands. Some of the tasks have been changed. So one of the manual dexterity tasks, for instance, is no longer the maze tracing, but it's circles. And those circles are vary in width depending on the age. And also, I believe it's a timed of how many they can do. So not only timed, but also how accurate. I think some of the materials that have changed so that the mats are much lighter to carry around. And the checklist, I think, is much better as well. So I think the checklist may be more sensitive. What I found before when I used the checklist was either you give it to parents, but they couldn't complete it all because there was questions related to school, and you give it to school and they couldn't complete it all because it was related to things at home. So I ended up with 2 incomplete movement ABC checklists. So I kind of gave up on it, but I think this next version looks more promising. And then I think the increased age band will be helpful to identify young adults with DCD, because before we were limited to the Brunics, which went to 21. We at least go to 25 now, and the checklist does the same.
Yeah. Haley just put the bands in, which are 3 to 6, 7 to 11, and 12 to 25. If the rest of you aren't following the chat. So, and I will say that I'll do a shameless plug that in April we're going to follow this up in a bit because we're going to take up a paper that Priscilla Templin and John Kearney have done on low motor competence or developmental coordination disorder, which is, I think, one of those questions that's always out there about, so they do a poor score on the MABC, but is the problem, really a neurological or something that needs to be diagnosed, or is it that a child has had very little experience? And I think you see some of that come out in Nadia Valentini's work in Brazil, where the kids haven't had a lot of the experiences that sort of are inherent in these tests. So, and are they really children with DCD, or are they just children who have lower motor competence? So I think it's sort of part of this continuum you just talked about, I think. So anybody else have some questions? Because we're going to wind down here.
Jane, can I jump in and ask one?
Oh, David, where have you been here?
Well, yeah, just hiding behind my picture. I thought I'd leave this question to the end because it goes a little bit beyond the paper. But first, Jill, thanks so much for a fabulous paper and a fabulous talk. I'm wondering what you can tell us about early predictors of autism, motor predictors in particular, and particularly like very early during infancy. And again, I know that's beyond the scope of this particular paper, but obviously there's a connection. So I'm just curious what you can tell us about what we know there.
Yeah, for sure. So, so one thing we know is that difficulty with breastfeeding, so poor suck swallow, we knew was predictive of more significant conditions like cerebral palsy, for instance, and in some cases autism. But it's also a very strong predictor of DCD. And so those early, coordination of suck, swallow, breathe is a good indicator, particularly in the high risk groups like children who are born preterm. And then we also know that early motor assessments are predictive of DCD, like children who get diagnosed with DCD later. But those motor scores tend to be just around the cusp of the first standard deviation. So conceivably in a clinical unit, for instance, people might interpret that a score of 85, for instance, it's right on the borderline, but they're in the normal range. So we don't need to follow them. But it's precisely those kids that score in that range. The gap continues to widen throughout childhood. So then they're below what's expected for their age and so on. So those early motor assessments do have some predictive validity later on, but they're not alarming scores at those young ages. They're just on the cusp.
Yeah. And so these are the early motor milestones that you're talking about.
Well, still motor assessments. So milestones per se, like the traditional ones, kids with DCD tend to meet their milestones on time, except walking for some might be the later end of the normal range. So they might be at 14, 15 months instead of, 12 months, for instance. But it's more the other tasks that would be on an early assessment. So like pincer grasp and being able to, I'm just trying to think of what some of them are off the top of my head. But the items in the Bailey or the Peabody are the ones where they would score similar to the normal range, but at the low end.
And are they similar when we're looking at children who ultimately go on and get a diagnosis of being on the autism spectrum? Because I know there's a whole wide range they see out in the literature of potential early predictors of an autism diagnosis. And they seem to range from everything from, deficits in predictive reaching to delayed onset of walking. So it seems quite broad.
Right. Yeah. Well, there will be some literature coming out. One of my PhD, I'm on her committee, a student from Belgium has done some video analysis of early early years, so that first year of life or first 1 or 2 years, and has found differences in movement quality in children with DCD. So I think we're gathering more and more tools that can help us with that early identification, which is, what we want is to try and identify kids sooner and not waiting until they're, 7, 8, 9, when they're already getting issues at school, whereas parents first have identified a concern at age 3, for instance. And there's this long gap between being identified and receiving any help or intervention. So they're coming, and I think we've got some warning signs. They're not necessarily discriminatory, so there might be some overlap between the early signs for autism and the early signs for DCD, for instance, because both have issues with breastfeeding. But it's a marker that we shouldn't just pay attention to, oh, we have a feeding problem, but this feeding problem could indicate a neurodevelopmental disorder down the road, and to make sure that those kids are followed.
Yeah, thank you, David. That's interesting. I had
Thanks, Jill.
a person who came and talked to me once about the difficulty children were having latching for their breastfeeding. That it was like the whole coordination, bringing the head to the breast was, how she was asking me what I should do because I'm not a therapist, but she was really struggling herself with her patients whose children were having trouble with these very early things that are never picked up, really. I think that's what she was sort of making a point about.
Yeah. I just, if there's no other questions, I just wanted to highlight a few things because I was anticipating somebody might ask, well, is it DCD or is it a symptom of autism? And I just wanted to highlight some neuroimaging evidence that I think gives more support to being it a separate condition. Again, we had some students look at the MRI evidence of brain structure and function of children with autism, DCD, and ADHD. And just to summarize this, so the evidence indicated that the neural correlates of co-occurring conditions were more widespread and distinct compared to the single diagnosis, and that the majority of findings suggest that each neurodevelopmental disorder had more distinct neural correlates than shared features, suggesting that each disorder is distinct despite commonly co-occurring with each other. So this is my why I'm also going down the DCD route as opposed to considering it a specifier. And the other important reason, as I said, was about intervention. So co-op intervention is the most effective intervention we have for children with DCD. It's a cognitive approach to learning motor skills. And just to show you some evidence here, this was a group of 24 children that we saw. We had brain imaging before and after intervention and also measured their motor skills. And this is their performance and satisfaction of motor goals that they wanted to achieve. And these are not only statistically significant, but also clinically meaningful differences with quite a large effect size of difference in their ability to learn motor skills with this intervention. And just exciting as well, we saw increased functional connectivity in their brain imaging, in their sensory motor network compared to the precentral gyrus, which of course is where the motor cortex is, and the frontal parietal network with the middle frontal gyrus. So that's related to the cognitive nature of the intervention. So we saw differences in functional connectivity, but we also saw differences in structure of the middle cerebellar peduncle and the vermis of the cerebellum. So these also have connections with sort of the sensory motor network. So we do have evidence that this approach is also effective for children with autism. So it's another reason why I think we should, increase awareness about this co-occurrence and then the treatment options that are available to support them and improve their motor skills.
Wow. Just finished with a bang there. Thank you. That was great. Yeah. And as my denouement, I have one more study to show you. Very nice.
So those results are under review at the moment, and they will be presented at DCD 15 So, or at least, sorry, I should say we've submitted abstracts to DCD 15. We don't have a decision yet, but I just think it's, and also the flip side is because DCD is under recognized overall, if we can use autism where there's a lot of publicity and feedback, then we might be able to increase awareness of DCD in the broader population, not just in this subgroup. So
just to make that double underlying point, in the United States, I think the NIH has only funded 2 or 3 studies on children with developmental coordination disorder. I think we were the very first ones to ever be funded by NIH, really. I mean, and again, a lot of money in autism, a lot of awareness about autism, but very little on children with DCD. And in fact, one school person said to me when I gave a talk one time, we don't need one more diagnosis. I said, you don't, but the parents need to understand what's going on with their children. It's not about you.
Yeah.
but that is, kind of an attitude of some people with another diagnosis, but understanding, I think, underlying what's going on. So again, I want to thank you. Thank you for a wonderful talk. There have been lots of people who have said that as well, but this has been great. I'll remind everyone that next month is the IMDRC Journal Club is on March 21st, and Jackie Goodway is going to talk about her work on an initial pilot and feasibility study looking at children's motor skills and parent support for physical development. She calls it her mini movers. And then in April, we're going to come back and do this again with DCD with Priscilla and the issue of motor competence. So I invite you all to come back for that. This will be recorded and loaded up on the website in case you weren't able to be here or you would like to share it with your classes. It's always available, and all of the history of all of the IMDRC journal clubs are on the IMDRC website. If you're a member, just a little plug for, doesn't cost much to be a member. You can have access to the links for the previous journal clubs that are really from the journal club where you as a student presented a paper to now have the author present the paper is like, wow, that's very cool. And to have these insights. So Jill, thank you very much. Appreciate that.
you're most welcome. And thank you so much for inviting me. And I hope to see some of you in person in Ghent.
Yes. Yes. Go Ghent. Yes. Hopefully. All right. Thank you very much.
Thank you, everyone.
Jill, if you'll stay on for just a second.
Sure, I just about hit the leave button, so you caught me just in time.
Yeah. I'm going to hit I'm not going to, I'm going to stop the recording.